as a physician and surgeon, with, I believe, based on what you had said, that you came to I think you came into the province in 2005. By my counting, that would give you approximately 18 years experience as a physician and surgeon in Nova Scotia, correct?
Yes.
Yeah, okay. So, as a physician and surgeon with 18 years experience practicing in Nova Scotia specifically, is it your opinion that the implementation of vaccine mandates was a necessary public safety measure?
Vaccine mandates were an unnecessary public safety measure.
Okay. And similarly, was it your opinion, or is it your opinion, that the implementation of vaccine mandates was a reasonable public safety measure?
No, they were not a reasonable public safety measure.
The vaccines were rolled out, and as we got into a vaccine mandate situation here in Nova Scotia, did you have any direct or indirect experience with adverse events in your medical practice with respect to the COVID-19 vaccinations?
Yes, I did. And just to clarify, the term is not adverse event due to vaccination.
Okay.
The term is adverse event following vaccination or following immunization. And the whole point there is that it's extremely difficult to prove that any adverse event is because of a vaccination. But that's part of the point of encouraging, or what we should have been doing, is encouraging people to report adverse events happening after. And there was not the sort of burden of proof for healthcare professionals, for example, nurses or doctors, to know that an adverse event was because of the vaccination. We are supposed to be reporting adverse events, whether we think they have any relationship or whether we can sort of explain any relationship or not. But I certainly had firsthand experience of at least, I have to be careful about patient personal health information, but life-threatening and many more cases of more minor thrombotic events shortly after vaccination. And when I first saw those, that was my first introduction into the online adverse events reporting system that you heard about. I must say, I think Eris left, but he must be many orders of magnitude smarter than me, because I don't know how you could get through one of those reports in 5 minutes. I mean, it took me 45 minutes. It took me 10 minutes just to figure out the links on the website to try to get to the 5-page PDF that you'd have to fill out. I found it, and I spoke to many other people that agreed with me, a very cumbersome, very awkward process to report an adverse event occurring after a vaccination.
Would it be your opinion that the way that the reporting system was set up, that it could potentially impair the reporting of adverse events, or otherwise inhibit the reporting of adverse events?
Yes. And in addition to that, is the whole issue of communication with us as healthcare professionals. We were relentlessly bombarded with how great the vaccines were, that they were safe and effective 1,000 times a day, this oversimplification of this new medical intervention, and informed by our various regulatory bodies, the College of Physicians and Surgeons in my case, that if we did not publicly voice support, or if we publicly voiced anything other than support of public health's statements about that we would be disciplined, or that we would face disciplinary measures. So not only is the mechanics of reporting the adverse event very cumbersome and time-consuming, the overall messaging, I can tell you, was not, be sure to look out for these adverse events. I think I saw one email during those years. And again, that was after the newspaper article that you heard about, that it sort of felt like public health was forced to say something about this adverse events reporting system. So every day, relentless, vaccines are safe and effective. maybe one message about reporting adverse events.
I'm going to ask you this in a general way, Dr. Davidson. Is it your opinion that the messaging that you just described had a dissuasive effect on the reporting of adverse events?
I don't know how it couldn't have.
And I'm going to back up just a little bit. You had mentioned thrombotic events. For those of us who aren't physicians, what is a thrombotic event? And just so everyone can remember, Dr. Davidson, I believe your evidence was you observed an increase in thrombotic events as an adverse event post-vaccination. Is that correct?
That's correct.
And what is a thrombotic event?
Simply put, it's blood clots forming in blood vessels. In my case, I saw a couple in arteries, but more so in veins. So much so that it did lead me to change my practice, my office practice, where I provide relatively minor venous procedures, to advising patients about more anticoagulation or medications that would reduce their risk of clots in the superficial veins and the deep veins, which could potentially be life-threatening.
Did you prescribe interventions in connection with adverse events post-vaccination?
Not specifically procedures for those clots. You don't really do procedures in the midst of an acute clot, but just the additional blood thinners, anticoagulants to prevent.
So prescriptions?
Yeah.
Okay.